The National Institutes of Health and U.S. drugmaker Eli Lilly are launching 2 clinical trials to test a new approach to treating the coronavirus. It uses antibodies that are mass-produced in a lab to try to stop the virus from damaging the body. Coronavirus patients at certain U.S. hospitals can volunteer now to enroll in these trials. CBS News chief medical correspondent Dr. Jon LaPook explains why this is so significant.
It's basically taking what our own bodies are capable of doing to protect us and trying to offer that to somebody who has not yet mounted their own effective defense.
NIH Director Dr. Francis Collins is overseeing a treatment he hopes will block the coronavirus in infected patients using monoclonal antibodies.
That monoclonal antibody sticks right to the part of this spike protein that represents the part that binds to the human cell and lets the virus get inside. So you cover that up and the virus has nowhere to go.
So unlike plasma donated by survivors, which contains antibodies to coronavirus and other past infections, monoclonal antibodies target only the part of the virus that allows it to attack human cells. And importantly, they can be mass-produced in a lab.
If it turns out the clinical trial is successful, we can start immediately offering this to patients who are sick.
U.S. biotech company Regeneron is also developing its own lab-produced antibody treatment. Dr. Mezgebe Berhe is running the trial.
If I treat you now, can I prevent the possibility of progression and hospital admission? Can I improve your recovery time? Can I also prevent transmission to other people?
Mary-Ellen Gaffney and her husband Michael Senek are participating in a Regeneron trial to see if monoclonal antibodies can prevent COVID-19 in someone exposed to the virus.
If we got the antibody and it did some good, at least we were in a position to take advantage of it.
All right, John, so John, I think one of the questions people are asking you now is, would this be safer or less safe than the plasma treatment that comes from survivors when it comes to antibodies?
Well, it should be safe, theoretically. Remember, the convalescent plasma taken from survivors has all sorts of antibodies, including antibodies to parts of the coronavirus that really don't hurt it very much. These are kind of designer monoclonal antibodies that only attack the part of the coronavirus that allows the coronavirus to attack human cells. So theoretically, it should be safe and it should be more effective. We'll see these trials that are going to see whether it's able to prevent infection in somebody who's already been exposed and for people who have mild or serious disease. Well, that remains to be seen.
And John, have to ask, does the lab antibody treatment have any impact on vaccine development? Are you still optimistic that a vaccine comes late this year or early next?
Yeah, I think we supposedly are on target for a vaccine, but not for several months. This hopefully can be a bridge to that. Remember, this is not actually a vaccine. It's giving you temporary immunity, hopefully, an immune factor that helps you fight this infection. But after a month or maybe 2, that antibody, the monoclonal antibody, should be out of your system for all intents and purposes. It is not going to help you in the long run to, say, prevent infection down the road in 6, 12 months.
All right, some great information. Dr. Jon LaPook, thank you very much.